On the occasion of World Brain Day, I thought I'd share with you what the theme of this year's World Brain Day is all about. So, brain health and disability leave no one behind. That is the theme for this year. As you would know, brain is probably one of the most eloquent organs, and it decides how we interact with our surroundings based on what stimuli we get, be it visual, be it auditory, be it touch, and how we react to it. Amongst the plethora of illnesses that can affect the brain, there are a few which may damage the brain if not treated correctly, identified early, and leave a lasting effect on the functioning of the brain. And this in turn may cause what is called a disability. For example, imagine a person getting a stroke. He bleeds into one part of the brain. If this is not treated early enough, correctly, then it might lead to permanent damage of that particular part of the brain. And then we might see the patient suffering from either a partial, that is hemiparesis, or a complete weakness on one side of the body, or one limb, or one side of the face. This is the disability. Now, how do we treat brain health and disability at per se? One, we prevent it for all it's worth. Two, we treat it. And three, in case any person eventually does suffer from any kind of disability or a deficiency, then we have to rehabilitate these patients back to normalcy as much as possible. So how do we prevent these illnesses and the sequelae of disabilities that they can cause? Number one, we must know of the various illnesses that predominantly cause these kind of disabilities. For example, strokes. They can be hemorrhagic, they can be ischemic, they can be infections, they can be dementia, they can be epilepsy, that is seizures, they can be migraine related, or they can be purely because of trauma. So identifying these illnesses at the very early stages and then treating them will reduce the burden of disability. Adequate diet, maintaining a healthy lifestyle, avoiding alcohol, tobacco, drugs, making sure that you avoid illnesses or at least treat illnesses like diabetes, hypertension, liver diseases, renal illnesses early enough before they cause secondary effects on the brain. Secondly, how do we treat these illnesses? For example, imagine a scenario of a stroke, a hemorrhagic stroke. If it bleeds into one part of the brain, identifying this hemorrhagic stroke early enough, evacuating the blood from that region so that it doesn't lead to permanent deficit in that particular area, or a stroke in which the blood supply is obliterated, that is stopped. Do we need to take the patient in to open up the clot in that particular blood vessel, that is an angioplasty, or can we manage with just blood thinners itself? Or imagine a scenario where there is an infection in the brain. Before the infection leads to a permanent damage of that part of the brain, the infection may be TB. There are medications enough for it. The infection can be fungal, the infection can be viral, and so on and so forth. Identifying them early enough before they cause any damage. Or if a patient is suffering from seizures, that is epilepsy, identifying where the epilepsy is coming from, are they responding to medications, do we need to further test them so that we do MRIs, we do EEGs, we do video EEGs, finding out which particular part of the brain is releasing these waves that causes these seizures, and if possible, if not medically, can we resect them, can we remove them from the brain and possibly give the patient seizure freedom. Or maybe medications for migraine. Headaches cause a severe deficiency in our workforce, and so on and so forth. There are various illnesses, they have to be treated early, correctly, before they cause any permanent damage. So, brain health needs to be identified early. There should be access to information. There should be access to diagnostic tests. And finally, if a person eventually does land up with deficiency, then we need to reintegrate these patients back into society. The rehabilitation, it needs to be physical, mental, emotional, social, financial. Physical rehabilitation may include simple bedside exercises or measures to get a patient out of a ventilator, or trying to stimulate the patient to come out of unconscious state, that is coma. Today we have advanced robotic techniques wherein we can mobilize the patient even when the patient is unconscious. Physiotherapy plays a major role. Cognitive rehabilitation, making sure that the patient can come back into society, do his calculations, his memory is good, speech, understanding, so on and so forth. So brain health and disability. How do we identify it? How do we treat it? And how do we prevent it? That's in a nutshell for you. Thank you.